Hello everyone. Today we'll discuss the important questions expected in the coming NEET PG exams, and also we'll discuss some of the important previous year's questions. It will be helpful for your rapid revision as well as for your NEET PG exam. Okay, first we will discuss about two important drugs in the treatment of BPH from the autonomic nervous system. That is, one is called tamsulosin and silodosin. These are the uroselective alpha 1A blockers. They are used in the treatment of BPH. What is BPH? Benign prostatic hyperplasia, or also called BHP, benign hypertrophy of prostate. Okay, so in this condition we can use the drug called tamsulosin as well as silodosin. Okay, why we are using this and what is the location of alpha 1A receptors? Because these are the drugs, they are blocking the alpha 1A receptor, uroselective alpha 1A blockers, uroselective. They are mainly present in the urethra or urinary tract system. Why we are using only these two drugs? Why not other alpha blockers? Because they are uroselective alpha 1A blockers. So what is the location of alpha 1A receptors? They are located in the urinary bladder, neck area, prostate and urethra. So when there is stimulation of this alpha 1A receptor, so contraction of these structures like urinary bladder, neck, prostate, urethra, and contraction leads to increased resistance to urine flow and also produces LUTS. What is LUTS? Lower urinary tract symptoms. These are the common symptoms occur in BPH patients in elderly geriatric male patients. Okay, when you are giving this tamsulosin and silodosin, they are the uroselective alpha 1A blocker and they will block the alpha 1A receptor located in the prostate, urinary bladder, neck as well as urethra, and relaxation of these structures leads to improving the urine flow and reduces the resistance, improving the urine flow as well as reducing the LUTS symptoms, lower urinary tract symptoms. So by this way, these two drugs called tamsulosin and silodosin are helpful in case of BPH. What is another advantage of these two drugs? So this drug we can use in the BPH patients with normal blood pressure as well as hypotension patients, BPH with hypotension but with caution. Why we are using these drugs in normal blood pressure as well as BPH with hypotensive patients? Because these drugs only affecting the alpha 1A receptor present in the urinary tract system, okay, but does not affect or without affecting the receptors in the blood vessels. So that's why there is a minimal or lesser risk of producing the adverse effect called orthostatic hypertension. That is the reason tamsulosin and silodosin are helpful for BPH patients with normal blood pressure as well as BPH with hypotension, but we can use these drugs in hypotensive patients with caution. That is the only we have to remember the point clinically with respect to BPH with normal blood pressure as well as BPH with hypotension. So that is called tamsulosin and silodosin. Comparatively all other alpha blockers, the main important problem is postural hypotension. That's why we have to start the other alpha blockers at bedtime, and starting dose is very minimal. Initial dose is very small. Okay, but in case of these two drugs, without producing or minimal risk of producing postural or orthostatic hypotension, we can use in BPH patients with normal blood pressure as well as hypotension with caution. So that is the one important points related to drugs called tamsulosin and silodosin. Apart from this, we can expect the vasomotor reversal of Dale in your exam. That is called adrenergic agonist. So when you administer, it produces both vasoconstriction and vasodilatation response, that is called vasopressor, and vasodipressor, that is called biphasic response. So what is the meaning of vasomotor reversal of Dale? When you administer adrenaline, it produces biphasic response. After that, if you administered alpha blocker like pentolamine, okay, later the adrenaline produces only beta 2 mediated vasodilatation, because beta 2 receptors are not blocked by this pentolamine because it is a alpha blocker. It blocks the alpha receptors. So vasopressor or vasoconstriction response is absent. So administration of alpha blocker after adrenaline, we can see only the beta 2 mediated vasodilatation. So that is called vasomotor reversal of Dale. So what is about re-reversal of vasomotor reversal of Dale? Instead of administering alpha blocker like pentolamine, if you administered beta blocker, so we can see only the alpha mediated vasoconstriction response. So there is absence of beta 2 mediated vasodilatation, because the given drug, that is beta blocker, it abolishes or it blocks the beta receptor. So only alpha receptor mediated vasoconstriction response we can see, that is called re-reversal of vasomotor reversal of Dale. So that is also possible question they may ask, or they will give the image and identify the phenomena. This is the way of asking questions in your recent exams. Okay, so you have to be ready with as well as concept based as well as image based case based scenarios as well. Okay, thank you all.